Welcome to Life on Pause, a podcast defining the experience of being a young adult with cancer.
Hello and welcome to Life on Pause. My name is Jill Robertson. I'll be your host for today. I am the Four Diamonds Program Coordinator at Penn State Health Pediatric Oncology. I'm here with Dr. Stephanie Estes as a follow-up discussion to the webinar titled Cancer and Blood Disorders, When Disease Treatment Pushes Fertility and Family Planning Decisions to the Forefront in Adolescents and Young Adults. Dr. Stephanie Estes is a fertility specialist at Penn State Health in reproductive endocrinology and infertility. Thank you for joining us today.
You, Jill. Glad to be here.
We heard a lot from our three panelists about things that they experienced going through cancer treatments and fertility issues that they either have dealt with or may be dealing with or may have to deal with in the future. And we had a great discussion, but we didn't get to talk a whole lot about what options are really available for people, such as our panelists, when they are facing infertility, once they've decided that they want to build a family. I wanted to bring you here today and offer some information about how you might approach some of these male and females with different conditions.
Yeah, thanks for the opportunity. It is really challenging to discuss because there are a lot of options, and that's really a great thing. So first of all, I would just say, to our listeners out there, if there's any question, one of the best things you can do, is have a consultation to discuss your specific circumstances and your disease process, because that may impact how we make recommendations to you. And so, for example, if we're thinking of someone like Joe, and in the general sense, from the male reproductive process, males, the traditional therapy is sperm cryopreservation. And we heard about some of the awkwardness of this, and it truly is. So when you walk in to see us, it is scary, it is awkward, but we will help you get you through it because it is such an important opportunity. And so we take your history, we go over some of the things that we would consider. Do you have a partner? No partner? We're thinking about things that are related to egg and sperm and reproduction. And as we go through those things, then we're making an assessment of maybe what treatment will someone get, whether it be for sickle cell or cancer or something else that we're looking towards. Make sure that it seems appropriate to have some type of fertility preservation. And then fertility preservation truly by our national guidelines, so this is the American Society of Reproductive Medicine, is set up so that you can save and use in the future eggs and sperm. There aren't any really medications that can do that. So when we're talking about males, then we're talking about sperm freezing. So sperm freezing is a process where we have the sperm given in a collection room, and then we put that sperm into, amazingly enough, liquid nitrogen, freezes it really fast, and then it can be stored for an unending amount of time. That sperm can then be stored at a long-term storage facility and then shipped to wherever you live in the future. So it's a great opportunity to have as a backup if needed for future pregnancy.
As a follow-up with that, we did hear from Joe that, like in his case, he didn't have a sperm count at all, and he tested multiple times.
Yeah, we always want to try to give that option. So we would check and then we do multiple evaluations. So if that's not effective, then we often involve our urology colleagues to see what may be the reason why there is no sperm. And if someone's gotten chemotherapy or radiation in the past, maybe the testicle is not working. But at the same time, maybe there's some other reason. Maybe there's a blockage or some reason why the sperm can't be produced or in the ejaculate. And so we look through all of those reasons. If it comes to the point where no sperm can be identified, and sometimes you can have a testicular biopsy or other aspirations of different parts of the male anatomy to get sperm in a different way. Or we do have sperm donors, so sperm banks where people have donated, and we can use those to help couples as well. So a variety of options of not only your own sperm, but other ways that people can have family building. And that's the great thing about this with us is that we can say, okay, well, this might not work, but we have another option here. And it might not always be the way that you think of for having children, but if it's really a goal, we can get there and help you.
Yeah, it's something that would give people hope in knowing that it's not a one-step process.
Sometimes, it is not clear at the beginning what the answer might be, but we are going to work with our patients every step of the way. And also, like, my nurses are great, different types of people involved in the care, support network that gets through this whole process, even though it sometimes has decision making that needs to be made emergently or urgently. And it can seem like a lot of pressure and stress during that time. But in the end, you can't get these sperm back depending on certain types of treatments. So that's why we're talking about it, because we just want to make sure that we're more forward looking than looking backwards and wishing we would have done something when we could have.
So some of those other procedures that you talked about, extracting the sperm in different ways, how invasive are those procedures?
They are usually pretty quick procedures. Urology completes them. It does usually require some type of anesthesia. And then the lab, the IVF lab, and the urologist coordinate to have those sperm then frozen in a different way. And so all of that is a part of the multidisciplinary process that we use for fertility preservation.
Is there anything else that you think is helpful for males to consider that might be going through a new diagnosis and just working through some of the things that they may face?
Yeah, I think just having the thought process that this is going to be potentially a difficult conversation, something that you don't talk about necessarily every day, but that we are there to help you. And I think sometimes we try to put up little sperm pictures or different things and do that back at the lab. But we also respect people's confidentiality, so we don't have it necessarily as out there as perhaps other things may seem. But that's not because we don't think it's important. It's just this try to have this balance between, the privacy of what people are doing and then some uh, part of way that we deal with it is humor. So if you can deal with our humor, you're going to do a good job because it's part of the process.
We talked, I think you and I might have asked you just like off to the side, not in the webinar, but as far as doing the sperm donation at home, why that's not usually a good option.
It is a challenging discussion, and we will accept sperm specimens from home. But to be honest, the best way to give the specimen is right beside the lab that's going to receive it and process it. And when we think about we're here in central Pennsylvania, and there can be snow some days. There are some days there isn't. It's cold. You bring that in, that can affect the motility of the sperm. Maybe it's really hot out, and you just get in the car and sit the specimen on the side. That can affect the sperm. So all of these variations, we don't want to decrease the quality of the specimen. So if we can have the sperm collection in the awkward room and then pass it off directly to the lab who are there to receive that, then it just turns out to be the best specimen possible. So we're trying to make it good for that reason.
One of the other blood disorders that we talked about in the webinar specifically was sickle cell. And I think you touched briefly on some of the genetic component of that and things that reproduction fertility specialists can do for a couple who may be facing passing that trait on to their offspring. But is there anything else specifically that you think our listeners would find helpful?
Yeah, thanks. I think that brings us to the other side from the female side of things. So we need to look at how we can obtain eggs. So, online it may seem easy. Just go and get your eggs harvested, and voila, you're finished. So it's just a touch more than that. And so when we talk about egg freezing, and that would be the first step to offer someone who was a female who would like to have fertility preservation. Basically, you go through an IVF cycle. So if anyone's had a family or a friend have infertility in a different way, It's the same process. You have to come in and have blood work and ultrasounds in the morning. We follow the size of the follicles. And so in that follicle is an egg, typically on average, one egg per follicle. And at the right time, we give certain medications so that the eggs can be removed. It's an ultrasound that's placed in the vagina and has a needle into it with sedation. So overall, people do really well with the procedure. And then we have those eggs retrieved in the follicular fluid. And the back behind us in the procedure room is our embryologist. And the embryologist is looking through that follicular fluid to remove the eggs. And then those are what can be frozen. Or you can take it one step further and you can combine the egg with a sperm specimen. Say someone has a partner in a long-term relationship or would like to use donor sperm, a variety of options. You can create embryos. And then that gets to your point where we were talking about what can you do with those embryos. We can then take some cells from those embryos and send them for pre-implantation genetic testing according to many diseases. And so there can be specific diseases like sickle cell, et cetera, that are looked at in those embryos amongst other chromosomal analysis. And so then patients can have the opportunity to know what the results are in regard to potentially not transferring that disease to their future children.
That type of procedure where you test the embryos, is that also something, whether you went through cancer or not, something that, say, like an advanced maternal patient may choose to test their embryos for XYZ disease?
Yep, exactly. And so you can have what's called PGTA, which is looking for aneuploidy. Aneuploidy is the word for abnormal chromosomes, and that's kind of all of our chromosomes. Usually, females 46XX, males 46XY. And so it looks at all of the chromosomes, including the sex chromosomes, that can be evaluated. So, for example, if there's a trisomy 18, which is a lethal anomaly, then you would not have to transfer that embryo. And then above and beyond that, we can do PGTM, which is for single gene disorders. And so those are things like sickle cell disease. We can have different types of cystic fibrosis, something that the lab can make a probe for that can check for that specific disease. And there's also actually some PGT ways that we can look for structural rearrangements in chromosomes. So it does get pretty complicated. And that's why, it's nice to talk about it in a more detailed way, because there's tons of education that our PGT companies give, and videos and all different types of things where you can look through that and see if that feels right for you. And you don't have to do it. So it's an option that is out there to do the genetic testing.
Great. Another thought that I had was, when you talk about retrieving the eggs, I think you were talking in terms of prior to cancer treatment, the actual medication that you would receive for cancer treatment. But let's fast forward through someone's there. Let's say that someone has gone through their cancer treatments, they're considered in remission, cured, and 5 years later, they want to have a family. And I guess I'm wondering, if they froze their eggs, would you use those eggs automatically, or would you see what their egg production is like in current time, and perhaps maybe go from there, depending, maybe they won't need as much assistance?
Yeah, good point, Jill. So we typically usually always reevaluate people. So from the male side, if someone's had treatment, they come back years later, we always check the semen analysis again to see where we're at for a starting point, and then have people try to get pregnant if there are sperm present. Same thing for eggs. So if we do a generalized testing and someone's having their menstrual cycle regularly, we always allow that person time to get pregnant. But at the same time, we have in the back of our minds, this person has been through a lot, and it definitely can affect the reproductive system. So we don't have people out there forever and ever. So even though if someone's 23 years old, typically the time that we want people to try before doing infertility workup is a year. But if someone's had cancer, therapy, let's say for chemotherapy, we would not have them wait that long. We would do things sooner. And then that way you have the option of using the frozen eggs or the frozen sperm after a time that seems more reasonable than waiting that full extent that we normally would.
We talked briefly about insurance coverage for some of these different procedures. And you may not know the ins and outs of that, but typically, if someone has insurance, they would at least get their appointment covered. But I know the coverage is kind of different for, once you get into some of the procedures.
Yes. And so this is why we have our lovely financial counselors. So I always refer directly to them. But in summary, usually across the country, fertility testing, which is like that initial evaluation, is often covered. And also fertility preservation counseling. So those type of things are covered benefits unless you haven't met your deductible for that year. Um, and then, after that is where things can become different. So, at Penn State Health, we have the joy of having the Four Diamonds Fund, which is just fantastic resource because patients here who have a cancer diagnosis, whether males or females, have fertility preservation coverage to do cycles. And that's just fantastic. Unfortunately, we don't have coverage for things that are not cancer related, so it can be a little bit tricky, but we do try to find other resources and ways to support our patients in those settings. And I think over time, the cost of things, we write letters for loans from banks. I mean, we do everything that we can, but an egg freezing cycle is probably going to be about $10,000 to $15,000 on average if you don't have coverage. And then sperm freezing is a lot less because you don't have to go through all the injections and the procedure that the egg freezing does. So sperm freezing, we can probably do for about $1,500. And then storage fees, and again, these will change over time. Storage fees right now for long-term storage, which are special facilities that keep sperm, eggs, embryos, etc., are about $350 per year. So that's what a general estimate would look like. And as a note, these things, sperm and egg freezing, are for post-pubertal males and females, meaning people who've already gone through puberty. We do have some other things out there like ovarian tissue freezing, which can be performed for prepubertal girls. So that's where you kind of take a specimen of the ovary and freeze it and then can implant it later. There's also testicular tissue freezing, but that's still considered to be experimental because there haven't been a lot of pregnancies from it, from the male side of things, but we're continuing to progress with new options. So that's why even, a couple months from now, maybe there's a new article out or a new procedure that might be able to be offered. So it may not be the same things that we're talking about today as everything is continuing to progress.
Right. And that's the great thing about medicine. We're not stuck where we are.
Right,
Um,
right. Yep, and it's always gotten better. I mean, think IVF was only invented, some years ago, even potentially in some of our lifetimes, and look where we are now. So that's why it's always a great idea to keep those contacts open, because then you can see what is it today that we can offer to you, and it may be different than yesterday.
right. So the concept of taking ovary tissue and implanting it later is, I don't know much about that. So how does taking a piece of tissue from your ovary help you get pregnant later?
So that occurs in the prepubertal girls, meaning before puberty, for people who haven't had their menstrual cycles yet. And so the ovaries are not active yet, but you can still save that tissue, that ovarian tissue, and it's been done in different ways. And then in the future, number one, you can implant that tissue either into a place that's where the ovary came from and have some hormonal stimulation and then potentially get pregnant. Or you can implant the tissue in the arm and the abdomen, different places where then that person can have stimulation of the tissue to do IVF. And then you can get embryos from that tissue. And it's amazing. So it's come a long way.
I think those were the areas where I felt like it was important to follow up on our webinar discussion. Was there anything else that you feel is important to share?
I would just, again, reiterate that, there are so many options and it's hard to go over the specifics of a person's individual experience. So let's just think about fertility preservation and make sure everybody knows about it. And it's not for everyone. So if you say, hey, look, this is not for me in the future, I might do a gestational carrier or do adoption or something else. That is totally okay. We just want to be able to provide you with options and then you can make the decision. And literature has suggested, at least if you've had that ability to decide, it makes the survivorship so much better because you've had the opportunity. So, let's keep it as a topic of interest.
Informed decision
Yeah.
making. And yeah, and if it's something that your care team doesn't bring up to I would just encourage patients to be their best advocate, or a patient's parent be their advocate, and ask those questions.
Yeah, because there's so much going on. It's so busy that, it's something that is challenging, but we try to make room to fit everything in.
Great. Thank you for joining us today for Life on Pause. Make sure you subscribe, like, or follow us on YouTube or Spotify or wherever you listen to your podcast. Have a great day.
Thanks for listening to Life on Pause.
Ideas or suggestions for future episodes? Feel free to share them with us.
Join us for the next recording on the third Tuesday of the month.
Until next time.